Diagnosis and treatment of vitamin D deficiency. Diagnosis and treatment of vitamin D deficiency involves assessing an individual's vitamin D levels and implementing appropriate interventions to restore optimal levels. Here is an overview of the diagnosis and treatment process for vitamin D deficiency. Diagnosis of vitamin D deficiency. Medical history and physical examination. A healthcare professional will typically start by taking a detailed medical history and conducting a physical examination to assess for any signs or symptoms associated with vitamin D deficiency. Blood test. The most common and reliable method for diagnosing vitamin D deficiency is a blood test to measure the levels of 25-hydroxyvitamin D, 25-OH-D. This test determines the circulating form of vitamin D in the blood, which reflects overall vitamin D status. Reference ranges. The interpretation of vitamin D levels may vary depending on the reference ranges used by different laboratories. Generally, levels below 20 nanograms per milliliter, 15 mol/L, are considered deficient, while levels between 20 to 30 nanograms per milliliter, 50 to 75 mol/L, may indicate insufficiency. Optimal levels are typically considered to be above 30 nanograms per milliliter, 75 mol/L. Treatment of vitamin D deficiency. Vitamin D supplementation. The primary treatment for vitamin D deficiency is vitamin D supplementation. The specific dosage and duration of supplementation depend on the severity of the deficiency and individual factors such as age, underlying health conditions, and lifestyle. Ergocalciferol, vitamin D2, and cholecalciferol, vitamin D3, are the two commonly used forms of vitamin D supplements. Vitamin D3 is preferred as it is more effective at raising and maintaining vitamin D levels. The dosage of vitamin D supplementation varies but typically ranges from 1,000 to 500 international units, IU, per day. Higher doses may be prescribed for severe deficiencies under medical supervision. Sunlight exposure. Moderate exposure to sunlight is another natural source of vitamin D synthesis in the body. Spending time outdoors, especially during midday when the sun's rays are strongest, can help the skin produce vitamin D. However, the amount of sun exposure needed depends on factors such as skin type, geographical location, time of year, and cultural practices. It's important to strike a balance between sun exposure for vitamin D synthesis and protecting the skin from harmful UV rays. Dietary modifications. While it may be challenging to obtain sufficient vitamin D from food alone, incorporating vitamin D-rich foods into the diet can contribute to overall vitamin D levels. Good dietary sources of vitamin D include fatty fish, salmon, mackerel, and sardines, fortified dairy products, fortified cereals, egg yolks, and mushrooms. Lifestyle factors. Adopting a healthy lifestyle can also support vitamin D metabolism. Regular physical activity, maintaining a healthy body weight, and avoiding excessive alcohol consumption can help optimize vitamin D levels. Monitoring and follow-up. After initiating treatment, regular monitoring of vitamin D levels is important to assess response to supplementation and ensure levels reach the desired range. Follow-up blood tests may be conducted after a few months to determine if adjustments to the supplementation regimen are necessary. It's important to note that the diagnosis and treatment of vitamin D deficiency should be done under the guidance of a healthcare professional. They can provide personalized advice, monitor your vitamin D levels, and make appropriate recommendations based on your specific needs and health condition. Subscribe and like for more videos.